This started on April 18th, 2021 at 10:30 in the morning when my partner Mike and I got a call for a 66-year-old male having a heart attack.
For a call like that, all cardiovascular calls, there's usually a time component that's pretty critical. So we hustle around and we get our gear loaded and we get off the ground as fast as we can.
As we got into the ER in Ronan, came around the corner and I looked into the room, I realized I recognized my patient. He was Marcus, an old flight nurse for Alert, and he and I had known each other 20 years.
I'm sure that when I saw Linda, I was, thank God it's Linda. And she probably went, it's Marcus.
He was a stellar flight nurse and I wanted to be just like him. So it was surreal to take care of him.
We want people in the cath lab within 60 minutes. In his case, it's too long before we can get the procedure done. So we give people a common clot buster called TPA. And he was given that in the field, but it didn't work for him.
Clot buster didn't work. This is not a good thing. And I'm probably an hour away from the nearest cath lab, which is Kalispell. So, it was an emotional day. It still is.
A lot of times when we get there, if the patient looks pretty stable, both of us will take reports so that we have a really good understanding of what's going on. But you could tell on this one that minutes literally counted.
Part of him being a flight nurse and being a nurse anesthetist at the time, he's fully aware of what's going on. He knows how critical his situation was, which is the reason why I think he said to me, Linda, you gotta get me out of here now.
I've flown this route many, many times, looking out at the lake and crushing chest pain, still wouldn't go away. Linda's giving me stuff. And I thought, what an appropriate place to die. Helicopter looking out here.
At one point I was changing one of the settings and I noticed his rhythm shift from a perfusing rhythm to ventricular fibrillation. And I looked up at him and I saw him kind of slumping over.
And he said, Linda, he's in VFib, start CPR. So I pulled my helmet off, climbed up on the bulkhead, and started CPR. And when he said all clear, I let up off of Marcus and we shocked him. To both of our surprise, Marcus woke up, looked straight at me, said, Chambers, did I go out? And I said, you did. And he said, you know I'm married, right? Because we're this far apart. I said, I do. I looked at my partner, he said, he's good. He went back into better rhythm.
There's always a sinking feeling when you defibrillate somebody. Sometimes they don't wake back up and you go right into CPR. But he came right back up with his eyes open and blood pressure got better, so I was really grateful for that.
We continued on a little further. Now we're getting closer to Kalispell. Mike looks at me again. Linda, CPR. He's back in the rhythm. I said, okay, climbed back up on the bulkhead, started CPR again. We shocked him again. This time, he didn't wake up talking to me. He awoke, kind of looked around, but I knew it was getting more and more intense as the flight continued on.
He went into cardiac arrest about 4 minutes from arriving here. So that's a lot to get done, which includes stabilization, defibrillation, establishing an airway, making another call to the emergency department to let them know, hey, we have a change. We basically needed a resuscitation team available on the helipad.
When we got into Kalispell and landed, we were very adamant that we got to get him out now. We got to get into the cath lab.
I defibrillated him another 6 or 7 times, I think, in the cath lab while everybody else was doing everything else that needed to be done there. It's a very complex and coordinated effort.
I'm incredibly humbled, thankful, but humbled by the years of experience and education that were waiting for me. It's just me.
You just don't realize when you're in the moment how significant what you're doing really truly is.
We literally watched him die in front of us and we brought him back. And so we're grateful for the outcome, but what if he didn't come back? What if I push that button and he doesn't wake right back up and we have that terrible outcome, right? So it triggers a lot sometimes. And then knowing that he's part of alert history, that would have been a tragic way to end. I'm glad we were part of the solution.
I think Alert in particular takes their pride in being in Montana and going into these tough situations and getting people out and saving them. And this is another save. I mean, it's unbelievable.
The Alert team is certainly one of a kind, and it's well known throughout the country for what it does.
Since Alert's inception, they've gone on over 19,000 patient flights and saved over 2,000 lives. When patients hear the sound of that helicopter coming, it's such a relief.
Alert is a special gift to this hospital. They keep people alive.
Very honored. It's an amazing thing.